Welcome to today's video where I would like to summarize to encapsulate all the important messages that someone seeking treatment for addiction to drugs and alcohol can take home and use as startup information to build on as they continue seeking and receiving the care they need for addiction rehabilitation. This information is derived from a number of topics I've discussed on this channel and questions I've received from viewers of Dr. BMS channel. So I will put it in bands or thematic areas which summarize the whole of what you need to know in addiction rehabilitation treatment. I hope this will be of benefit to you, my viewers of Dr. BMS. Before we start, have you subscribed to our channel? Please subscribe to Dr. BMS channel so that you get to know whenever we have new videos. You join the community of people who believe in the health of body, mind, and soul, and we grow together by educating, enlightening, motivating each other on these areas of our health. So straight on to the issues. The first issue I would like to mention is that addiction is a disease. When someone is abusing alcohol or drugs of addiction, marijuana, miraa, prescription drugs, alcohol, these ones are very common in our country. And we have the ones that are common in developed countries, but they are finding their way into our country. Heroin, cocaine, amphetamines, and many others. All these drugs of addiction, when someone starts using them and loses control, it's because they have developed a disease. Addiction is a disease, and in this disease, changes happen in your body, specifically the brain, where you lose control. When you get access to these drugs, you want more and more of them, and you lose control. Even when they are hurting you, even when you can see they are leading you astray, you are unable to stop. So the message here is that a person who is addicted is a sick person. This is not a person you would compare to someone doing something out of free will. Tell them it's your choice. You have chosen that path. So if you want to kill yourself, it is okay. No, consider this person as a sick person, the way someone has malaria, pneumonia, and the actions you take when someone has malaria or pneumonia are the same actions you should take with someone who has addiction. You need to seek out care for them, take them for treatment, and the treatment for addiction is addiction rehabilitation and is found in addiction rehabilitation centers like the Fountain of Hope Treatment Center, where I am talking from. The second point I would like to summarize is that addiction, being a disease, can affect anyone. It can affect the old, the young, it can affect rich, it can affect the poor, it can affect people in any professions. Even doctors get addicted to drugs and alcohol. Even law enforcers, policemen who are supposed to arrest you if you are found with marijuana, they also get addicted to drugs. So it can affect anybody. It does not discriminate. And so with that understanding, then you know that this is a disease and everyone is vulnerable. You have to protect yourself by making sure that you do not cross the line. We've said previously in our videos why people get addicted primarily is because they were predisposed. There's something in their genetic makeup which makes them unable to control themselves. But beyond that, it is because they got exposed to this drug and used it to levels where this control was totally destroyed. And on this second point, it does not matter whether you are predisposed genetically or not. If you use alcohol or marijuana or any other drug of addiction to levels and at a regularity beyond which control becomes difficult, you will become addicted regardless of genetic predisposition, regardless of your age, regardless of your status in society, regardless of your knowledge, your profession, you will get addicted. When I made a previous video about high class alcoholics and functional alcoholics, for example, this was in furtherance of this knowledge that it can get you even if you are drinking expensive drinks, even if you say, I go to work, I take my drink and I go to work. Eventually, as you continue using it, you will pass the point of no return and you will become addicted. The third thing is that in our country, Kenya, today, there is an emerging trend where addiction is moving, especially among young people, is moving away from the traditional addiction to alcohol and moving towards addiction to newer drugs, particularly marijuana. We are observing many young people today who are getting addicted to marijuana, and some of them do not even use alcohol. So, you as a parent, when you have your young children, your teenage children in college, in school, watch out for smoking of marijuana, which is the new addiction that is coming out. And this means that the traditional way people used to engage in addictive activities like taking alcohol, going out to the club the whole night, coming back drunk and disorderly. You may not observe this, you may not see this because these young people may not be using alcohol. They may not be going to clubs to take alcohol for long hours, but instead they're smoking marijuana. Sometimes they smoke just in the neighborhood, sometimes they smoke in the house. It may be for just a short period of time. They're away, they sneak away to smoke, and you may not notice that they have been away, but slowly an addiction is developing. So watch out for this and beware that new addictions are coming. The fourth point I would like to summarize is that addiction to alcohol and many other drugs, but particularly alcohol, is such that an addict may be taking this drug, this alcohol, on a daily basis. Every day they take the alcohol for hours, they come home drunk. But we have also a form of abuse or addiction to drugs where someone takes a big amount for short periods, then feels the effects, stops a bit, and starts again. This is called binging, binge drinking, or binge abuse, where you use the alcohol, the marijuana, whichever drug it is, for a short period, but in big quantities to harm your body, to destroy that defense that I talked about, to take you beyond that line of no return. And then you suffer the consequences. You stay for a short period of time without using and you repeat again. So watch out for people who are using drugs of addiction excessively, abusing them. They need not be people who use every day. They could also be people who use for certain periods but in large quantities. So you have this scenario where someone drinks mainly on weekends, but the whole weekend they are stoned out. they drink until they collapse, they black out, and they take days to recover. Part of the weekdays, they are not able to work because they are recovering from their indulgence over the weekend. This is binge drinking, binging during weekends, and it may be a sign of addiction to alcohol or to drugs. And one interesting thing to note about addiction is that most people in addiction also are in denial. They rarely accept they have a problem. So while the rest of the family, everyone around them can see this person is abusing drugs, drinking too much, and is becoming addicted, they are denying and saying, I have no problem, leave me alone, it is my life, I can manage. That problem of denial is an important characteristic of addiction, and families must recognize this and not be deterred by it, so that you move forward and seek care for this person even when they are in denial, because if you wait for them to accept, they will die of addiction before they ever accept that they had a problem. The sixth point, because I'm moving quickly over them, addiction tends to be a family problem. We call it a family disease, not because everyone in the family will start drinking or abusing drugs when one of their member is, but because everyone gets affected one way or another. So we have that person who is drinking, who is smoking, who is addicted, who is abusing drugs, but we have the rest of the family who are facing the consequences. The consequences are normally negative. This person who is drinking becomes a problem to the family. You have to bail them out. They waste resources. Sometimes they come and cause problems, even violence in the home. Relations are strained, and so the whole family suffers. So we say one person is infected or has the problem, the rest are affected. And so in our rehabilitation therapy, the treatment for addiction, we do not just focus on the person who is drinking, we also focus on the family, because we know that there are some things the family may be feeling as a result of this person's addiction. Also, there are some things that the family may be doing to make this addiction get worse. We call it enabling. We are also aware that there are some things that they are not doing to make the situation improve. So they are codependent. They are like people who are drinking by proxy. This person is drinking and causing havoc, but the effects may be like the fumes in quotes just flow in the air and reach you, and you also behave like you are drunk, but you are not drinking. That's why we call addiction as a family disease, and because of that, we normally encourage families when one of your member has got a problem of abusing alcohol or drugs, you have to take action. Take action because the whole family will be affected if you do not take action. Taking action means that you speak with one voice. You sit down as a family and discuss that one of our members has a problem, we need to help him. And you all agree. You seek consensus. You talk with one voice. If you have a situation where one family of the member of the family thinks, well, don't disturb him, leave him alone, he will be okay. And others are saying he's doing too much, he's drinking too much, he needs to seek care. That kind of division will not help the family to solve this problem of addiction. The seventh thing on my list is that addiction and mental problems usually occur together. Not all the time, but in most cases, they occur together. One can start and lead to the other. It's like the question of the hen and the egg. One comes, the other is not far off. So when you have a member of the family or a person who is abusing drugs and they have gotten to a point they are addicted, We as therapists in rehabilitation center, we are always on the watch out to know if this person has developed a mental problem. We call it psychosis, drug-induced psychosis, madness that is caused by drugs, drug-induced psychosis. Or it could be that they had a mental problem which led them to use drugs. For example, some people are depressed, some people are going through difficult times in the family, at work, social circumstances are difficult, economic circumstances. As a result, they start taking alcohol to relieve that pressure. In Swahili, in Kenya, we call it kupunguza mawazo. So as they continue using the alcohol to alleviate their mental anguish, their psychological problem, then they get addicted. So you can get addiction because you have a mental health problem which you're addressing the wrong way by using drugs, or you can get addicted and in the process you develop mental health problem. The two tend to happen together, and good rehabilitation therefore requires that you look out for both of them and treat both of them if they occur for you to get a good recovery. The eighth point, that when someone has an addiction problem, and we said the family notices this, it has to take action, as we said, because it's a family problem. They are brought into rehabilitation. In rehabilitation, we use a combination of medical, psychological, and other therapies to achieve a cure. It's not a one way of treatment. People come in and ask me, Dr. BMS, do you give them an injection? What do you do when they come? Do you pray for them? Do you just talk to them? What is it you do? And I tell them we do all of those, which is the truth that when you are rehabilitating someone in addiction, you use a combination of therapies. We have got medical therapies, like I mentioned a short while ago. If you have a mental problem, we'll have a psychiatrist come in and give you medicine for depression, for psychosis. If you have other bodily problems, we'll also have doctors looking at you and giving you medication. We now have medication that specifically stops you from wanting alcohol and drugs. One of the commonest ones used today is called NALTREXONE, and I made a video about NALTREXONE. So we have medicines the way we give in other hospital conditions like malaria, pneumonia, but we also use psychological techniques. We have to counsel this person. We have to find out what is stressing them, what is making them not settled in their life so that they want to go and punguza mawazo. We have to look at family relations, family dynamics. We have to look at work-related issues. We have to look at this person's belief systems. We use religious counseling as part of the treatment. So, in summary, that rehabilitation is a combination treatment. We have many experts working in. We have doctors, we have counselors, we have psychologists, we have psychiatrists, we've got religious ministers, we've got social workers. All these people work together to help this person recover from rehabilitation. Quickly, the ninth point is that rehabilitation takes time. This one I keep repeating to people. It's not a touch and go. You don't just come in and we do something magical and you are cured. No, it takes time. In our country, Kenya, the minimum recommended is 3 months. But even these 3 months falls short of the recommendations or the standard practice world over. In many countries, rehabilitation will go for 6 months, 9 months, or even longer, 1 year, or even longer. Our 3 months is the bare minimum because it's expensive to rehabilitate people. So if people are going to be in rehabilitation for 3 months, they are not working and you are paying, you can see for a poor country it may be a problem. So WHO, Ministry of Health, they came up with this guideline that we rehabilitate for 3 months, which is the bare minimum. This just emphasizes the point that rehabilitation takes time. It's not a touch and go. You have to get this person turned over from the body that is ill, from the mind that is ill, from the soul, the relationships within the family, their view of the world, many other things have to be turned over, and it takes time. You cannot do this thing in a week or two, because if you attempt a shortcut, usually the rates of relapsing or going back into drugs is very high. Number 10, that naltrexone. I talked about naltrexone. Naltrexone, in a previous video, I said, I asked, is it a magical cure for drug abuse? It's the modern drug that is used most commonly to treat addiction. It works by disrupting, by blocking your brain, your body from enjoying, feeling the pleasures you get from drugs. Most people, when they use alcohol and drug, they get a high, they get that good, nice feeling, which makes them feel wow. That's usually in the beginning, but later on, things go downhill. They lose control, they become drunk, disorderly, they may even collapse into a blackout. But initially, there's a certain nice feeling we call euphoria, the good feeling. This drug, naltrexone, blocks that good feeling. So it helps someone who is trying to quit addiction by making their body not respond to their drug of choice. While we say it is a good drug and some people may see it as a magical cure, but in fact, it does not work in a magic way. It has to work in a person who has been prepared to use it. So, how it is given, first, it's given in combination to the other treatments, like I said, but it's most importantly given after the other therapies have applied. So someone comes into rehabilitation. We treat their sick body. They have malnutrition, they have liver disease, they have hangovers, headache, their appetite is poor. We treat that usually through detoxification and other medical therapies. Then we look at any mental health problems they have. We look at social problems, relationships. We give them the right information. It could give them motivation to change through psychology and counseling techniques. At the end of all those therapies, we give them naltrexone because it's now going to protect them should they get access to drugs of addiction. You know, when you're in rehabilitation, there are no drugs in a good rehab like Fountain of Hope. We don't give you drugs, not at all. So there are no drugs. There's no cigarette, there's no alcohol. But when you leave after 3 months and you go out there, the world hasn't changed. The bar that was at the corner of the street is still there. People will still pass near you, they are smoking. Some of the friends will still invite you. So those temptations can trigger a feeling like, let me try. Naltrexone then comes in at this point and blocks you from having that desire, that craving. So it is a good drug, but it has to be applied the right way, not as a shortcut drug, otherwise it will fade. Number 11 on my list, rehabilitation happens in rehabilitation center. When you leave the rehabilitation center, the treatment is not over. In fact, we say recovery from addiction is a lifelong process. There's no time you'll come and say, now I'm cured, I should go back to drinking because I'm cured. No, it's a lifelong process. So after rehabilitation, we go to the next stage called the aftercare stage. In the aftercare stage, you are not in rehabilitation. Sometimes you may be going out of the rehabilitation and coming back, like you go to work and come back in the evening. We call it the halfway house. But even if it's not halfway house, if it's a situation where you have left and gone back home, you are still in close contact with your therapist. You are still followed up closely. Your family is still supporting you very actively. We link you to other people who are in the recovery stage. We link you to communities of people who used to abuse drugs, who are addicted, and they have turned around. So we call this the aftercare program, and the aftercare can run for as long as possible. On average, it goes for about a year, and you are strong enough maybe to make a decision if you are going to continue having that close follow-up, or we can lessen the follow-up. But the message here is that someone leaving rehabilitation is not 100% cured, like they can be led to go face those temptations and challenges. They need support from the family, from their therapists, and from other people, social groups of people who are changing, determined to leave the old way of addiction. That is the aftercare. Second last on my list, and this one elicits lots of questions when people come. Relapse. People who have been in addiction, they went to rehabilitation, and they left rehabilitation and started abusing the drugs they were using before. We call it relapse. People ask me, do you get relapse? How can we be sure that this is going to work? The message to give out there that yes, relapse is real, it can happen, and it should not signal a treatment failure. Usually, good rehabilitation reduces the chances of relapse but cannot guarantee, just like any other treatment. You cannot say if you go to hospital and you have malaria, you cannot get malaria again. You may even die while you're on treatment. So these are realities of treatment because we are using modern scientific treatment. This is not magic. So relapse can happen, but good rehabilitation where multiple therapies have been used, the family has been closely involved. The person in rehabilitation goes back and is well supported to continue with a new life. The chance of relapse into addiction and the need for second rehabilitation are much less. But if relapse happens, we normally advise families do not give up hope, bring the patient back into rehabilitation, and every time they are rehabilitated, the chances of success are much higher. In our center, we notice that with rehabilitation, we can manage about 60% of the people who come here to go out and change their life. About 40% may relapse, out of which, if they come back into rehabilitation again, about half of them will now get cured and go. But there still remains a small percentage of people who may have this problem of relapse for a long time to come, perhaps for life. And last on my list, I hinted on it previously that recovery is a lifelong process. When you have become addicted to a drug, to alcohol, it means at some point in your life you passed that point of no return and your body lost that control. That means when you come into rehabilitation, we are trying to rebuild that control. And so, as we rebuild it, we want it to remain there forever. We do not want a situation where something can tempt you to cross that line again, because not only will it be bad for you from a physical, mental, psychological point of view, but there's a risk that you cross that line again and now you destroy everything, even the ability to rebuild that line of defense is not there. So recovery is a lifelong process. We never recommend someone who has been in rehabilitation and tell them that now, if you go through rehabilitation and aftercare, after about 1 year, 2 years, you can start using alcohol or marijuana because you are cured. No, it's not like malaria. It's not like an accident. If you are a footballer and you injured your leg, we can fix that leg and you can go back to playing football or whatever sport you did. But in alcoholism, in drug abuse, addiction, we cannot recommend that because you are in lifelong recovery. Thank you very much. I hope those 13 areas can help you as a person who is seeking first time information, factual information about addiction, about what goes on in rehabilitation center, and you can build on that by reaching out to us for more information. We are open as Fountain of Hope Treatment Center to give you this information to help you, the family, and the person struggling with the addiction and drug abuse so that you recover, regain your life, and become a useful member of the society again. See you.